Dr. Milton Mills.
Yes.
All day.
Yes.
We've known each other for a few years. I've heard you give the most amazing talks.
Well, thank you.
And you have a really interesting approach to vegan nutrition. And so I'm so happy that you're willing to sit with me and have this interview and maybe allow a lot of other people to think about what you have promoted and thought about, researched, etc.
Well, it's my pleasure.
And you know, being a medical doctor, anyone in the vegan community, we're also eager to have someone give the stamp of approval to vegan nutrition. You got your education at Stanford University.
Right. That's where I went to medical school, and in fact, that's actually why I went to medical school, was because I knew that my primary interest was in the relationship between nutrition and disease. And I also knew that unless I was a physician, people would tell me, oh, you can't tell people that because you're not a doctor. And so I decided, well, I need to become a doctor so that, one, I will have a very sophisticated understanding of this relationship between diet and disease, but also so that I could have the authority to tell people with confidence, and a confidence they could trust, that in fact they could become vegans and not have to worry that they were doing themselves harm.
Right. And then you did residency as well at a very prestigious place.
Yes. My residency was split between UCSF program and Georgetown.
Mm-hmm. You stated in some of your talks that if you just observe human beings, they're omnivores, or they appear to be omnivores. I should say that. They're behavioral
omnivores, right.
Yeah, and that's not enough indication as to why we should be eating what we're eating.
No, absolutely. I mean, if you look at what human beings do, and if you were to decide that a human being should do something based on what you observe us doing, you might conclude that we should be wife beaters, that we should be drunkards, that we should be drug addicts. But we all know that those things aren't true. Those are things that we do a lot, but that we shouldn't do them. And while human beings are behavioral omnivores, meaning that many human beings choose to eat both animal foods and plant foods, that is not the best approach when trying to figure out which diet is the best diet for us to eat. I think it's best to look at our anatomy, our physiology, and our disease susceptibilities to see, in fact, which diet promotes the best overall health and is the most protective against all manner of diseases. And when you take that approach, what you see is that from an anatomical and physiological standpoint, we are clearly herbivorous mammals. And when we adhere to that diet, it minimizes our risk for developing chronic diseases. It maximizes the robustness of our immune system, which also minimizes our susceptibility to all kinds of infectious diseases.
Now, I've seen you do your presentations, and I always feel so smart when I'm sitting in them because you bring up really great PowerPoint presentations where it is very medical, it's very scientific in many ways, and I take notes as fast as I can, and I just think it's wonderful, and I don't hear anybody else taking this approach, which I feel that you create and fill a void in the whole vegan community. I mean, well, I just think it's fabulous.
I'm glad to hear you say that, because that is absolutely what I'm attempting to do. I want to present this information in a way that I don't think anybody else is presenting it. And in fact, that's one of the reasons why I have such a burden to complete the book project that I'm working on, because I don't see anyone presenting it in quite the same way. And so I think that's a niche that really needs to be filled.
Now, I know you can't go through your whole presentation in a few minutes of this interview, but I would really enjoy if you would take a little bit of the anatomy that we walk around with every day and correlate it to how we really are not omnivores.
Right. Well, what was interesting is that last night I was talking with some friends because we were talking about, of course, finding something to eat, and I made it the point that I am actually a vegetarian, and that I don't, eat flesh or animal foods, and of course, this one person who was present was saying how she enjoyed her meat, and I said, well, okay, I understand that. I said, but that again is not necessarily the best question to ask, or the best thing to think about when you think about what you should be eating, because if you ask a heroin addict if they enjoy shooting up heroin, they would say yes. So that's really not the point. And so I just started talking about some of the basic differences between carnivores and herbivores, and I talked about the fact that carnivores are intermittent feeders, and that is, in natural settings, a carnivorous animal mammal particularly, will eat maybe once every 7 to 10 days. Okay, and so as a result, these animals have gigantic stomachs. A typical carnivore can eat about 30% of their body weight at one meal. So that means that, for instance, a 45 kilogram wolf can eat about 15 kilograms of meat at one setting.
Wow.
Yeah, they can truly consume 30% of their body weight in one meal. Well, that means a 300-pound lion will eat can eat up to 90 pounds of meat at one setting. And in addition to that, what these animals will do if they make a kill, if they are able to kill a large animal that they can't consume in one setting, they'll cover it up with a bunch of dirt and brush and sticks and whatnot. And then they'll come back the next day when it's started to rot. It's covered with flies and maggots and loaded with bacteria. And they'll eat it, and they have absolutely no problem. And that's because their digestive system and their immune system is designed to handle rotting, decaying, pathogen-laden tissue. We become violently ill if we eat poorly cooked turkey. So clearly, we aren't designed to eat meat like a typical carnivore. Moreover, they can consume enough calories in one setting that it will last them a good week or more. Whereas your typical herbivore, because plant foods are a lot more abundant, much more readily available, but harder to process and digest because of all of the fiber and also some of the alkaloid compounds that plants put in their tissues to try and keep animals from eating them, plant foods take a lot longer to actually digest. So as a result, plant-eating animals tend to be what I refer to as batch feeders, meaning they will consume a meal, but then spend a good portion of that day processing that meal, and once that meal has been sufficiently digested and absorbed, they go back and they eat again. So they are not able to consume enough calories at one setting to last them not even a single day, let alone 7 to 10 days. They must eat multiple times throughout the day, just like human beings. Our stomachs are not large enough for us to consume enough calories to last us even a single day, let alone 7 to 10 days. And clearly we don't have the physiology or the immune structure that allows us to eat food that is loaded with pathogens and bacteria, because it gets into our system very easily and it causes food poisoning, and if not treated, will end up killing us, in fact.
Well, what about I've heard you talk about the jaw and the structure of the jaw. That's always so interesting.
Sure,
I think
sure.
you would.
Well, when you actually look again at the structure of the jaws of a carnivore, they're actually made like a pair of shears, meaning that the jaw joint is on the same plane as the cheek teeth, which allows the jaws to literally close in a shear-like fashion, so that when they close their jaw, they actually slice meat off the bone. The blade-like molars on the top part of the jaw slide past the molars in the lower jaw, which gives you a nice slicing motion that allows them to shear meat off bones, to cut through tough hides and whatnot, and that's what allows them to shear off these chunks of flesh and swallow them whole. Whereas with herbivores, excuse me, the jaw is very different. Instead of being shaped like a pair of shears, the jaw is the lower jaw has a pronounced L shape, and what in fact happens is that when the jaw closes, the top molars and the bottom molars actually come down on top of one another. So they don't slide past one another vertically, they come down on top of each other, and they slide across each other horizontally, and that's what gives you the grinding motion that we're familiar with, and that's what allows them to rip apart those plant foods so that they can tear apart the fibrous portions of the food to get at the nutrients that are inside the plant tissues. So it's a very, very different jaw structure. And the major muscle operating the jaw in carnivores is this muscle called the temporalis, which sits at the top of the head, whereas in herbivores, the major muscles operating the jaw are the masseters, which sit down here on the angle of the mandible, and correspondingly on the inside of the jaw, there's a different set of muscles called pterygoids, and that holds the jaw in a sling-like arrangement and allows it to swing the jaw from side to side, which gives you that nice horizontal grinding motion.
And then when you get down a little further with our intestines, isn't there a different
there's
track?
major differences, absolutely. The typical small intestinal length in a carnivore, they have very short small intestines, and that's because meat tissue, flesh tissue, is actually very easily digested. There's no fiber, there are no hard to break down compounds, so as a result, the tissue is very easily broken down, absorbed very quickly, so these animals only need a short small intestine so they can quickly absorb the nutritional material and get rid of whatever excess waste is left over. So for a carnivore, the small intestine is typically only about 4 to 5 times the length of the body, whereas again with plant-eating animals, because there's so much fiber and fibrous material, because the plant tissues are much harder to break down and extract the nutrients, the small intestine is much longer. It's 10 to 12 times the body length. And in addition to a very, very long small intestine, they also tend to have these very long, muscular, large intestines where they actually do additional fermentation. That is, they use bacteria to break down the fibrous portion of the plant tissues so they can extract additional energy and nutrients from those foods. And again, like a typical herbivore, the human small intestine is 10 to 11 times our body length, and we also have a very long, very muscular, large intestine, which, as we all know from the FiberCon and Metamucil commercials, if you don't have enough fiber in your diet, it's going to cause all sorts of problems because our colon needs a high fiber diet, and that's, again, classically a plant-based diet.
And I think most people don't realize that animal products have no fiber.
And absolutely
they think
no fiber
because they see tissue that's
right,
fiber.
No, it's not.
Isn't that interesting?
Yeah, no, fiber is the undigestible cellulose portions of plant foods, not the muscle fibers that are in in animal tissues.
Well, in your practice, what do you see that is most helpful to your patients, that makes the biggest change in their health? I mean, I know that there's quite a number of ones that are more common, but for you personally, which ones give you the greatest pleasure when you can overcome for a patient?
Well, you know, one of the diseases that is absolutely most easily and readily amenable to switching from a typical Western-style diet to a more plant-based diet is diabetes, because most people have what's called type 2 diabetes, which is a disease that's caused by what's called insulin resistance, meaning that the body becomes insensitive to the effects of insulin, and it's caused by a number of factors, including excess weight gain, eating too much animal tissue, a lack of exercise, too much fat in the diet, and so forth. And by switching to a plant-based diet, almost immediately the body is able to process insulin better and becomes much more healthy. And I guess, let's see, when was back in April, I believe it was, I was invited up to Rhinebeck to speak at the Mid-Hudson Vegetarian Society's Great American Meat Out. And I met a couple there. The male member of this couple was a gentleman who had been diagnosed with diabetes, I think, going on 8 years. And he was really, really very frustrated because he was a construction worker and he was used to being able to go out and work every day. And he was saying that he was having so much pain and so many problems related to his diabetes that it was starting to cause him to become disabled. And this was really debilitating pain. He had seen several different doctors, a rheumatologist as well as an endocrinologist for his diabetes, and no one could seem to help him with this chronic pain that he was having. They were putting him on all sorts of pain, narcotic medications, which he didn't want to take because he didn't want to become a drug addict, and he was really, really frustrated. In addition to that, his diabetes was just completely out of control, and he was having a very hard time trying to control it, and he was very depressed, very frustrated because he felt like that his health was falling apart and his life was slipping away from him. And one thing that I've learned to do is, a lot of times when I talk to my patients and other people about making change, I don't recommend to them that they change a lot, that they change their diet completely, or I shouldn't say not completely, but that they do it for the remainder of their life. What I say is, why don't you try it for 6 to 8 weeks? Because see, that is something that people feel like, okay, I don't have to make a decision for the rest of my life right here and right now. That's something that I can see, an end to if I don't feel like this is working for me. But I know that within that 6 to 8 week period, the changes that they will experience will be so profound and they will feel so much better that it will become a self-reinforcing lifestyle. Right. And I just received an email. His wife has kind of kept me sort of posted as to his progress. And she just sent me an email 2 weeks ago that it almost moved me to tears because she was saying that he's doing so much better. His diabetes is now in control. The pain that he's had for 8 years that nobody could seem to get a handle on is completely gone. He has lost 21 pounds. He is feeling so much better and so much healthier. And in her email, she was thanking me, but I give all credit to God because this is not something I invented. It's something He's told us a long time ago we should do. But it's so wonderful to see that, when people do make the appropriate changes, they get the immediate and wonderful and amazing results. I had another patient in my practice years ago, a patient by the name of Kathy Vest. This is a lady who went to the same church I went to, and I happened to start working at the clinic where she was receiving her care, and at the time she was very, very sick. She had really severe heart disease, very out of control hypertension, and her diabetes was just in terrible shape. She was taking both oral medicines twice a day plus insulin shots, and still her blood sugars were 2 to 3 times what they should have been. And the way Kathy would describe it, she said that whenever she would wake up in the morning, she would have to sit on the side of the bed for 5 to 10 minutes before she could even stand up, just to kind of get her bearings, to try and feel strong enough to do this. She wasn't able to walk a block without her legs cramping and severe pain. She was having all sorts of heart problems. And I started talking to her about eliminating the animal foods from her diet, and I must confess, I was trying to get her to go vegetarian because I was afraid of trying to push her too hard, too fast. She became completely vegan, And literally within 3 months, I had to take her off all of her diabetes medicines. She came off of 2 of the 3 antihypertensives that she was taking. And when she went back to see her cardiologist after about 6 months or so, he told her that her heart was growing new blood vessels where there had been blockages.
Wow.
And she completely had her life back. She was actually able to start working again. And she was able to go walking without the pain. And she and it's just, when you see these kind of miracles in people's lives, it's just amazing. It's wonderful. I mean, it still moves me. I mean, when I see this, because it's so real and so possible. And so I just try to, to relate these things to my patients, to try and help them understand you have a body that's designed to handle plant foods. When you put things in your body that shouldn't be there, it's going to make you sick. It's going to throw your physiology off. It's going to cause you kind of health problems. Why don't you do a trial of eliminating these things and see how you feel? And then you can decide whether you want to continue with the life that you now have, where you're feeling healthier, you're feeling better, your health is improving, or go back to the way things used to be. Personally, I don't know of anything that is worth, the feeling healthy and happy and whole. There's no food that is that important or that tasty that's worth sacrificing your health and your life for.
And when you stop to think about it, all the flavorings that we use is vegan.
That's something that
Isn't that interesting?
Yeah, well, that's something that I bring out in a talk I do called Meat Eating and the Biology of Disgust, which is where I point out to people that we even have the palate of an herbivore, that we don't like meat unless we try and make it taste like plants. All of the seasonings, all of the herbs, everything that we use to flavor our food are all plant products. And unless, and somebody, someone once said to me, well, all I need to do is just barbecue something. I'm like, don't you realize wood smoke is a flavoring? It's a plant flavoring. And there's a book called On Food and Cooking by an author named McGee, where he makes that point. He says wood smoke is a flavoring that's created when intense heat breaks down wood into some of the same aromatic compounds found in other spices and herbs. And so even cooking is designed or started as a way of transferring the flavors of plants to animal foods.
So
because unless we make them taste like the plant foods that we really crave, we don't desire them.
That's wonderful. Now, I want to put you on the spot. What is your go-to dish? Now, I know doctors have terrible diets because you have terrible schedules.
Right.
And you probably are one of them. Even though you preach everything, I bet you any money you don't eat the way you're supposed to.
Well, actually, I've tried. I have to say that over the last couple, I would say
last few days.
No, I would say much longer than that. Certainly the last year, I really worked hard to be more consistent with my own diet, because I can get by on say some hummus and rice cakes, or things that aren't the healthiest. But nowadays I absolutely make sure that I don't go more than a couple days without getting some green leafies in. I make it a point to try and include some form of legumes in my diet, and those are beans, peas, lentils, on a regular basis, as well as being sure to do the fruits and veggies. And the easiest way for me to do that is, I guess I would say maybe once a week, I'll go to the supermarket and I'll get fresh, and whenever possible I try to get organic. But if I can't get organic, I'll get the conventional strawberries, blueberries, blackberries, and raspberries, and some bananas, and maybe a little pineapple, and I'll blend it all up. I'll add some silken tofu to increase the protein content, and make myself a big, huge container of a smoothie mixture that I can have a glass full every morning. So that I know that I'm getting my antioxidants, I'm getting my fruit, and it's in a sort of just a very easy, compact and even portable way, because even if I don't have time to drink it before I leave for work, I can just pour it in a container, put the top on it, take it with me, and have it at my leisure. That's also my after workout drink, because again, it's antioxidants are really important after you've done a bout of exercise to help with the oxidative compounds you generate, as well as the tofu helps replenish some of the protein that I've used up. Now, so I do a lot of things like that. Now, when I have time to cook, one of my favorite dishes is a recipe that I learned from a Spanish lady. So I think of it as Spanish beans. And what it requires is you take 6 to 8 large tomatoes. You drop them in hot water so that you can peel them. You blend it up, and in one pot you take your pureed tomatoes, and you simmer it with a chopped bell pepper, and then in a different pot you cook pinto beans. And generally with my beans now, I soak them overnight, discard the water that I soak them in to kind of get rid of some of those sugars that can cause people some digestive issues. And then you cook the beans till they're about 3/4 done. You pour off that water, and then you pour over your tomato and green pepper mixture. Then you flavor it with garlic, and that's just to taste. I personally like a lot of garlic.
Salt and pepper?
Salt and pepper, and simmer it. And I'm telling you, it sounds simple, but for me, it is one of the most delicious things.
It is, but the simplest
ones. So good.
The simplest are many times the
yes,
best.
The best.
And I'll just throw in a little home ec tip here, that you should not put salt in the beans when they're cooking.
Right, until they're
because they may never get soft.
Right, that's absolutely
you always
you do it at the end.
Yes. At the end, yeah.
Yes, you told me that as well. Yes.
That's wonderful. I thank you so much for taking time out.
My pleasure, absolutely.
To be here and to do this.